early recovery, rehabilitation, and reconstruction. WHO is ready for that in health. We are ready for that with the partners. Maybe later I can give you a small example in the area of rehabilitation. Over to you.
Thank you, Dr. Rick. And actually, I have a question to you, Dr. Adham Ismail. The question is, with the multiple crises in the region, how does WHO ensure the continuity of funding of its health programs, and prevent their interruption? The question is from Mona Eid, الأهرام الاقتصادي, and Mustafa Hajjaj, آخر الأنباء.
Thank you, Mona, and thank you for the colleagues who posed the question. You know, following the leadership transition in 2024, WHO initiated a series of strategic reforms to ensure that our health programs remain impactful and uninterrupted, even amid growing geopolitical volatility and public health challenges. These reforms have focused on maximizing efficiency and agility through internal restructuring to streamline operations, country-level human resource reviews, to also increase our footprint on the ground to better align staffing with priorities, and cost-saving measures like increased digital engagement and reduced travel. Since January, maybe 2025, we've also embarked on a journey to address the challenges posed by the potential US cuts to our organization. We've undertaken a comprehensive prioritization exercise and undergone an HR realignment process to ensure that our resources are directed where they are needed most. This has allowed us to match available funding with program and staffing needs, giving us confidence in our ability to deliver on our mandate throughout the coming biennium 26-27. In parallel, we've responded to the regional crisis and the withdrawal of major donor by intensifying our efforts to diversify funding and adopt innovative operational models. These actions are all part of our commitment to safeguarding the continuity of essential health services and building resilient health systems, as mentioned by the regional director, even during conflicts across the entire region. Thank you, Mona.
Thank you, Dr. Adham. And we have Lina Nashabif. It seems that she has a question. Please let us know which outlet you are representing and to whom you want to address the question. Thank you. Lina? Can you hear me? Please unmute yourself. Lina. Okay, we will move to another question till Lina is ready. I have a question to Dr. Annette Heinzelmann. Dr. Annette, the question is about Sudan. Sudan has recently completed a large-scale cholera vaccination campaign. Lina, are you back? Okay. So it's about Sudan, and as I mentioned, Sudan has recently completed a large-scale cholera vaccination campaign amid ongoing conflict and displacement. Can you tell us more about WHO's role in this response and what more is needed to prevent further spread?
Thank you very much for this question. Maybe allow me very briefly to make some comments about the general situation in Sudan. So Sudan currently is facing the biggest humanitarian crisis in the world, with almost 30 million of people in need of humanitarian assistance and almost 20 million of people in need of health assistance. This is almost half of the population in need of health assistance. We are also seeing in Sudan the biggest displacement crisis in the world. 10 million internally displaced people are mostly living in precarious living conditions and shelters without access to safe water and sanitation, and with very limited access to health care. The health system is very much fragilized by this situation, and only 60% of the health facilities are mostly only partially functioning due to the attacks on healthcare, due to damaged infrastructure, and due to the fact that a lot of medical staff has left the country. When it comes to the cholera outbreak, which was declared in 2024, we have seen more than 120,000 suspected cases and about 3,300 deaths, which represents the case fatality rate of 2.8%. And this is by far above the international standards and really shows the problems of the healthcare system to struggle with, to cope with the situation. With regards to the cholera vaccination campaign, since the cholera vaccination started, WHO has supported the Ministry of Health together with Gavi and UNICEF to carry out these campaigns. More than 20 million people have received vaccination, and the current vaccination campaign are in the difficult to access areas in the Darfur states. The ongoing campaign targets 1.8 million people in extremely complicated operational conditions. And there is another vaccination campaign planned, mostly in West Darfur, which will start shortly and will target another about 600,000 people. It is important to say that vaccination is not a solution for cholera outbreaks. You need safe access to water and sanitation. You need access to medicines, to health facilities. So WHO is delivering medicine, pre-positioning medical supplies in all affected states. And we are also strengthening the disease surveillance and rapid response capacities. What is the main challenge for this response is the lack of adequate funding. We, us as WHO, but also all the health sector, is only funded currently at 30%, and this means that millions of people will continue not to have access to the health care they deserve. Thank you.
Thank you, Dr. Annette. And we have Sami Magdi from Associated Press with us. Sami, please unmute yourself and raise your question.
Hello, this is Sami from the EP. I have actually two questions, one on Gaza City and second is in Sudan, specifically on al-Fasher, which is in Gaza City, we have seen like doctors warning for weeks that operations there on the brink due to prevalent shortage of medical supplies and food. My question is, could you shed some light on the overall situation in the city? And is WHO able to deliver the required supplies? And what are the restrictions you face to deliver medicine and medical supplies? Also, how about the malnourished children who are still in Gaza City? Are you able to reach them with the required medicine? And second question is in Sudan, does WHO have like figures about malnutrition related deaths and famine related deaths in Darfur, specifically in al-Fasher? Are you able to contact people there?
Okay, thank you. Thank you for your questions, Sami. And we'll start with Dr. Rick for the part on Gaza City, followed by Dr. Annette for the Fasher in Sudan.
Yeah, thank you very much. A very important question. And by the way, just as we speak, the microphone was closed. So we are now in Khan Yunis. We had a strike nearby. So I think that's what I just want to say. The ceasefire is unfortunately not yet there. We absolutely need it, and I completely agree. There's a glimmer of hope. Everyone wants any plan to work, but it's not yet there. And this is when I come to Gaza City. Gaza City, where we estimate there's still between 200 and 250,000 people in Gaza City. So when we went there, we saw no movement from both north to south as from south to north. Very few vehicles. We were the only one. We were very much welcomed. And it's that we were this mission. We went to Al Ahli Hospital, and I said we delivered. Al Ahli Hospital is a private, it's actually a mission hospital, only 40 beds, now many more. And Al Ahli Hospital, together with the PRCS field hospital in Gaza City, Soraya, are the only two partly to minimum functional hospitals, and the only two hospitals where there is some level of trauma care. Even at Al Ahli Hospital, most of the senior staff have left. So that's the situation. The question was, are we able to bring in supplies? We did bring in supplies, trauma supplies. We brought in, but also IV, antibiotics, lab supplies, and some food for staff and patient. Now, Shifa Hospital, which used to be the biggest, by far the largest hospital in Gaza City, and myself, before this crisis exploded, coming to Gaza every month, since the crisis, actually from November, December 23, every other month. I was there again 6 weeks ago, Shifa. Then it's still at 600, over 600 patients, no more, 1,200 patients, almost 200 to 300% the bed occupancy rate. Currently in Shifa, more than 90% of the staff have left. The only unit which is minimal function is dialysis unit, and there is what we call a trauma stabilization point. So Shifa is basically, it's not even minimum functional. That's how it is. So only 2 service points currently in Gaza City. We try to supply as good as possible. The question was also related to malnutrition. That's more complex for us. We are not the only one. We do that together with UNICEF. We have a problem getting the nutritional supplies into Gaza related to the very few treatment centers. There used to be 8 treatment centers. Now there's less than 4 of this treatment center, and none of them anymore in the north of Gaza. What else did we do? I mean, just talking about this week. Besides that, we medevaced. It was supposed to be medevac 4 sick neonates from Al Hilu Hospital. One of the neonates unfortunately passed away in the night before, so we medevaced the 3 to the south because that hospital is not be able to care for that as well. We also did a medevac last week, Monday. We want to do more. I just want to stress, I think, because Dr. Hanan was alluding to the ceasefire, and I think we all want that. And when we start with recovery, one thing I want to raise, WHO has been consistently raising with regard to medevac. And the current, we medevaced 8,000 patients. We had assisted 8,000 patients, excluding the companion. However, that's a massive achievement, but there's still 15,600 patients on the list, of which almost 4,000 children. Oh, we want the last medevac was for 180 patients and companions. We want to expand. We are ready to expand to 3, 4, 5, 6 medevacs per month, for example. But what would really be a little game changer if we open up the traditional referral pathway to the East Jerusalem and the West Bank. Now, we've been consistently lobbying for that, and I think Dr. Hanan can also allude to that, because at the General Assembly, a group of countries stood up, etc., and they first did this through silent diplomacy, and now they've made it very clear they also want this to happen. And when there's a ceasefire, the East Jerusalem, West Bank being part of Palestine, we should get that back. Why do I say that would be a game changer? I think we can make sure that a couple of thousand patients can be actually transferred there to East Jerusalem and the West Bank. And then the most complex patients, we want more countries to open up. I really want to praise the country in the region, in the Embro region. I mean, I can mention many of them, but think about Egypt, the UAE, Qatar, Oman, well, also Turkey, etc. Europe is now finally starting to open up. We need to push much harder on that, and it needs to be a concerted action and a comprehensive approach. WHO is also ready to support the hospitals in East Jerusalem and the West Bank. Of course, we will need flexible resources for that, but we are ready to go. Over to you.
Thank you, Dr. Rick. I know that you need to leave, so any questions regarding Gaza, we can take it now. Sorry, Annette, we'll delay this the Sudan question till we receive another question on Gaza. We have Ashvin, and Ashvin, if your question is on Gaza, please raise it.
Thank you. Thank you for considering my question. What strategic plan WHO East Mediterranean or WHO have to restore the attainable health of Eastern Mediterranean region, especially in the Palestinian region, and what WHO have plans to mobilize human resources to challenging humanitarian aid supply, as well as restoration of hospital especially in Palestine and Gaza state.
Ashvin, what's your media outlet, please? Can you tell us?
This is Ashwin Barshinge from Observer Times, India.
Thank you. Dr. Rick, the floor is yours.
I think maybe the RD also wants to speak to this a bit. So first of all, the plans, I think, are pretty clear. And I think RD alluded to that also when she spoke about the General Assembly. Whenever there's a ceasefire, to our understanding, and very quickly after, Egypt, with a number of other countries, will organize a Gaza conference on early recovery, rehabilitation, and reconstruction. We have to think much broader than just health. I mean, the destruction is everywhere, massive, and we have to focus at all sectors. What you would expect when there's a ceasefire, that first of all entries are open for humanitarian assistance. Currently, we really struggle to get still up till now the supplies in, and we struggle still even in health, for example, to get specific supplies in. So that is the first step. The humanitarian support can be massively expanded as soon as there is a ceasefire, and the UN is ready for that. I want to remind everyone, when there was a temporary ceasefire, January, February, the UN, including WHO leading on health, etc., within 2 months, we brought in a substantial amount of supplies. The food became more diverse. There was a glimmer of hope, and situation was changing. We don't want a temporary ceasefire anymore. And this, so based on this conference, I think we are looking forward to a much more comprehensive plan for Gaza. But I also want to look at the smaller things. And just let me now look at what did we now already do on early recovery and rehabilitation in this crisis, besides all the humanitarian support we described. So we did already work in these 2 years, for example, assisting hospitals with expansion, National Medical Complex, where we expanded with a field hospital. We did the same in other hospitals. We are planning to do the same here in Al Amal for rehabilitation. We restored a number of, helped to rehabilitate a number of primary healthcare centers, etc. And if you allow me, I want to also stress in this 2 years mark, and I'm sure the EMRO colleagues will share that, WHO came out with a couple of very critical papers. One was on injury and rehabilitation needs in Gaza. And that's where I'm sitting now in Al Amal hospitals. If you talk about rehabilitation, I mentioned the figure that 169,000 people have been injured. WHO did an assessment review last year, together with the EMTs, but now did a much broader review with much more data. The shocking conclusion is that one critical result is the same, that 1/4 of this 169,000 people will have life-changing injuries. And so 1/4, that's more than 42,000 people, of which more than 10,000 are children. Now, over 5,000 of these people have faced amputation. Many of them children. We see other severe injuries, arms, legs, etc. I'm here in Alamal, which is the only hospital where you have in-services rehabilitation services for only 40 patients. Going now to Nasser Medical Complex, where there's an OPD, etc., but not with specific inpatient rehabilitation services. So currently, WHO is helping to expand PRCS with a field hospital focuses on rehabilitation, and also with a fixed hospital, which is already ongoing. Those are small rehabilitation efforts. However, when the ceasefire, we have to look at this. It's a much larger way. We have to relook at the core primary healthcare, and then the hospital infrastructure. There used to be 36 hospitals in Gaza. I had a discussion with the minister in Ramallah as well on this. Like, do you want to go back to 36 hospitals? Or do you want to focus to a number of, let's say, definitely in the north, we need a 3-level referral hospital in the center and the south. Then you need a group of general hospitals, but then you need a primary healthcare network, which are linking to that, and community health. We have to think much more creatively and specifically in topics as mental health. How do we integrate that at the various levels? What is the role of NGOs, etc., and communities? Then I think RD alluded to the more larger infrastructural work, etc. Yes, plans are in the making, but I think plans will have to will be changing, I think, over time. One small thing I want to mention is on the humanitarian area. A key asset we need, and I think also RD mentioned, is fuel. We still limit fuel in Gaza. Without fuel, no hospitals, no health facilities, etc. And the UN need a pooled fund for fuel, which should be readily available and consistently available, because otherwise we cannot even continue our humanitarian support. Over to you. And by the way, I still have 15 minutes. Over to you.
Okay, thank you, Dr. Rick. Dr. Hanan.
Yeah, thank you. I would like to thank also this specific question. Again, it comes to the core of what we've been discussing at global level among all of the UN agencies, among the 3 level of the WHO, transformation and reform. And Dr. Adham gave a little bit of a focus on this in his answering the first question that he had. But I think it's very important that we put things in perspective. The reality is, with the current funding shortages, it's going to be much more difficult for us to do what we had aspired to do in all of the services that we provide our member states, whether it's from emergencies to the other thematic programs. However, at the same time, it also is a great opportunity for us to start focusing more on innovative financing, which we've created a regional innovative financing task force that will work among members of this region. We've also been focusing on linking health with economy. And that's where the first flagship and the second flagship focus on what are the biggest burdens of diseases in this region? What is it that we need to do to reach to our aspired SDGs by 2030? And how are these flagships going to focus on filling those specific gaps? So it's a very good question that you ask. And it is looking at the whole health instead of looking at health as a burden, is how do we look as health as part of an investment for the countries? So I think we will be discussing this in much more detail at RC72, and please stay tuned for further work that we're doing on the whole access initiative, where we are working. It's a very complex matrix of strengthening research and development within the region, in enhancing proper digitalized warehouses at regional, sub-regional, national, subnational levels. It is looking also into the essential medicines lists at the country level. It is looking into enhancing primary healthcare and UHC. It is also looking into strengthening the regulatory authorities so that we can have better oversight on the local production capacity that has been a great appetite for many of our member states, including Egypt, Morocco, Jordan, UAE, Saudi Arabia, Iraq, Syria, Lebanon, even Yemen and Sudan and Afghanistan. Almost every single country in this region is keen on enhancing one or multiple pharmaceutical production or nutritional production entities in their countries. We are very keen on the regulatory and the oversight to make sure that these productions are pre-qualified, they are safe, effective, and affordable. On the affordability part in the whole access initiative, we have already partnered with our colleagues in PAHO and moved forward the pooled funding concept. And we hope within the end of this year and early year, we can speak more about where we've reached on that aspect. So there's a lot of work that we're doing. There's a lot of energy within the region, a lot of three-level collaboration within WHO. And through the Regional Health Alliance, we're also doing a whole lot of collaboration and partnering to be more complementarity among the UN agencies so that we can, through our presence at country level, we can support all of this effort. So thank you very much. And I think that same question will now go to Annette for Sudan. Thank you.
Exactly, yes. Pasher, Darfur. Yeah. Yes, thank you very much for the question about Al-Fasher. So yes, we are in contact with health staff and health authorities in Al-Fasher itself, and overall the health situation in this besieged city is really very, very concerning. So there is an increase of malnutrition cases, of trauma cases, and also of infectious disease cases. Currently, there is only one health facility, the obstetric hospital, which is still functioning and has to struggle with a limited number of staff, shortages of life-saving medicines and medical supplies, and also, as it's the only hospital, with limitations of surgical and inpatient capacity. With regards to trauma cases, trauma is a major issue. Trauma treatment is a major issue in Al-Fasher. Since the beginning of the crisis, there have been more than 15,000 trauma cases. And just to give you a more recent example, in the week of the 14th of September, there were almost 500 trauma cases which needed treatment in Al-Fasher. With regards to the question of the malnutrition, since January there were about 10,000 children with severe acute malnutrition which were treated in Al-Fasher. And in the region or in the surrounding of Al-Fasher, for example, in Mallet locality, where a large part of the people which are displaced from Al-Fasher are living, there are currently malnutrition rates of 34.2%, which is a record high since the beginning of the conflict. So altogether, a very, very situation. WHO, we are ready to go into Al-Fasher as part of a UN convoy, bringing in life-saving medicines, medical supplies, and vaccines if safe access can be granted and there is accessibility for a UN convoy. And if there are further questions on more details, we are happy to answer by email. Thank you.
Thank you, Dr. Annette. And a question to you, Dr. Adham. The question is about the resolutions adopted by the regional committee in previous sessions. The question says that they are always important, but how can they be translated into concrete action that makes a real difference in people's daily life? The question is from Mona Eid Al-Ahram Al-Iqtisadi.
Thank you, Mona. Thank you both Monas actually from here and from Ahram Al-Iqtisadi. I think this is a brilliant question because that was also one of our concerns. And by the way, it's a side event during our upcoming RC72. Let me just give you some numbers regarding the number of, we've had 3 consecutive studies on the number of resolutions produced from the year 2000 to the year 2019. 236 resolutions have been produced by the regional committee. And unfortunately, we had to sunset almost 72% of them. 65 only remained. And there were different factors that contributed to this. Maybe the text of the resolution was a bit aspirational more than really pragmatic on the ground, as the question alludes to, and maybe also some external factors like conflicts, and COVID and many other things. So yes, the question is very much valid, and this year, or maybe especially if I go back last year in the RC 71, we've introduced a number of important changes to the regional committee cycle. All of these changes had one clear goal: to deepen member states' engagement and strengthen their ownership of both the process and the outcomes of the regional committee resolutions. So this year's agenda, for example, and I really invite everyone to come and attend this year's, which is a landmark of change in the way we do business. This year's agenda is firmly rooted in technical matters that were proposed and selected by member states themselves, ensuring strong alignment with national priorities and a greater likelihood of implementation at the country level. They've selected them, so they should be implemented. We've also taken a proactive approach by consulting member states early in the summer on each technical paper, allowing them to shape the content of the resolution from the outset. One of the most significant shifts this year is that our sessions will no longer focus on presenting the papers, but instead on discussing the resolutions in depth, if they are pragmatic, if they are feasible, if they are doable. This creates space for meaningful dialogue with the ministries of health and their delegations, fostering a full buy-in and commitment of translating these resolutions into real action, as you alluded. Thank you so much, Mona.
Thank you, Dr. Adham. And actually, this was the last question for today. Apologies for colleagues media colleagues who shared or sent questions and time didn't allow to answer to them, but we will try our best to answer by email. And special thanks to all our distinguished speakers and Mr. Aziz Abu Aisha, who joined us today from the Red Crescent in Palestine. Until we meet again, stay safe.
Thank you, everyone. Thank you so much.
Okay, thank you all.
Thank you. Thank you, Rick. Take care.
Yeah,
Yes.
we just for your information, we just had a second strike very close by. So it's really, unfortunately, it's for me insane. You think it would stop, but it still doesn't stop. Yeah, so let's all pray and hope that this goes on, that this will really change over the next couple of days. For your information, I will have a discussion together with the Israeli authorities about this European Gaza hospital and something else. What we don't want, we want to, of course, make sure that in the north, that operations somehow will continue. We don't want to be facilitating even more of expulsion over the last couple of 100,000 people from the north to the south. So I think it's and I'm sure that my colleague Abu Aziz can allude to that, etc., because that's I think the Soraya Field Hospital and together with Al Ahli are the only two hospitals which are still partly functional. But anyhow, we will follow up.
Thank you, Rick. Thank
Bye-bye.
you. I want to thank Mr. Aziz again for being with us and for elaborating on all of the efforts that is also by the Palestinian Red Crescent, and thank all of the journalists online with us and all of those who are following. There's a lot happening in this region, so please continue to follow us on our social media accounts. Take care, everyone, and see you later. Bye-bye.